Hello, everyone. So, once again, I am here with yet another episode of Eclectica. And today, as you know, that we have someone very, very special with us. And she is none other than Dr. Aylin Baysan. So, I will tell a little bit about Dr. Aylin. And quickly, I will call her in. We were just facing little technical issues, so we got little late, but that's fine. So, well, Dr. Aylin Baysan is the reader in Cariology, Barts, and the London School of Medicine and Dentistry, Queen Mary University of London. And I think we all know about Queen Mary, we have heard about it. So, not wasting any more time, I will just call in our guest of honor and special. And I think this is a very, very special episode of Eclectica, and everybody is going to enjoy because today Dr. Aylin will enlighten us on a very, very important aspect in dentistry, that is minimally invasive dentistry, because that is the expertise area she works on. And particularly in these pandemic situation or post pandemic, we will get more insights from her. Well, so I will not waste a single minute. So let me call in our special guest. Good afternoon, Dr. Aylin, and thank you so much for joining me today here. And I welcome you to Eclectica, and thank you for accepting my invitation to this program. How are you? First thing, that is my first question.
Thank you very much. How are you? I'm very well. How are you?
I am good. I'm good.
Excellent.
So Dr. Ellen, may I request you to tell about your field of interest and exactly what kind of work you do, and if you just tell about yourself to put it very straight to you. Yes.
Thank you so much. Thank you. So, as you mentioned, I work at Queen Mary University, Barts and the London School of Medicine and Dentistry. So, I am a reader there, and I am the program director for MSc in minimally invasive dentistry as well. We just introduced this program, and it was introduced timely. We didn't, we weren't really aware of COVID-19, but my interest, as you mentioned, I am very passionate about oral health and also how we can manage the dental caries in aging population, especially. So I did my MSc in geriatric oral health, and then I did my PhD in root caries, and I used toothpaste containing high fluoride, which is 5,000 ppm. It's called, in different countries, it is called Prevident, or it's a Colgate toothpaste, Durafat, 5,000 ppm. In the UK, it's called. And also, I used ozone to manage root caries as well. Yes. So, as I mentioned, I am always looking ways how we can protect our tissues, our teeth in the dentition, and this is why. Of course, with our dean, with the program director support, we introduced, and with Queen Mary University support, we introduced this new master program. So thank you.
I think that is wonderful to know from you, because particularly when there should be some way where people can get formal education, and I think the way you brought up this minimally invasive dentistry in the form of a course or a master's program, I think that is very, very beneficial for people who have joined dentistry, or maybe who are aspiring freshers, or not only that, any other people from the field of dentistry can, I think, take this up, and I think our viewers, when they see us live, or if they see these videos later, I'm sure that they will definitely try to contact you on this, and I'll make sure that they do so, because it's a very, very important aspect that you highlighted, and very beneficial for students and for all of us here, because we really don't get all these insights in a very ready-made way. So, okay, Dr. Ellen. So, as now we know, and as I know that your field of interest is minimally invasive dentistry, or in short, that we call as MID. So, can you enlighten us exactly what this is? This MID, and how exactly does it work?
Sure, thank you so much. So MID is a concept, and it is based on all factors that affect the onset and progression of dental disease. It's not only for dental caries. We can have this concept in all other dental diseases as well, such as periodontal disease, tooth surface loss. So onset and progression of all dental disease, and therefore integrates with first early detection. We need to detect it to do something, right, for our dental disease. So early detection, and then controlling the disease at an early stage is quite important for MID concept. And then management strategies, of course, including the prevention as well. So this is the whole MID umbrella. And we can start the MID with patient education. Especially this is the best time for us, because we are working with our patients remotely, right? In a way, we are calling them on WhatsApp or Skype or FaceTime or Zoom. So it is a wonderful opportunity for us to educate our patients. And then also to start thinking of using, considering the risk assessment tools at the same time. For dental caries, there are established risk assessment tools. And for tooth surface loss, again, there are some research-based assessment tools. But anybody, I believe that you know your patient's background, you know how to manage these cases later on, so you can really work on your risk assessment yourself. For periodontal disease, it's very clear as well. So why not, let's start developing standard operating procedures in our practices to do the risk assessments, and then we can start detecting the dental disease at early stage. Then we can help our patients. So, for instance, if I can give you a very short scenario. So, if the patient comes with very early root caries lesions, root caries is nowadays is very common in aging population, and also with the periodontal disease, when there is a gingival recession, root is exposed to the oral environment, and we know that dentin is not that strong compared to enamel, because we have less inorganic content in the dentin. Then root caries may develop, it's not that, but of course we need to, this is why risk factors quite important. So according to your patient, you can assess this. So why not to have a early detection of that root caries development, and then do advise your patient with any controlling, to control the disease, or for prevention purposes, such as, why not to apply dental varnish? Why not to advise your patient with the modifying the diet? I know it's not easy to change. I'm not saying change, but to modify the diet. Concentrate on the oral hygiene instructions. We can do these oral hygiene instructions remotely. we can just meet with our patients. Why not in the meantime, instead of just waiting for the practices to open, or even the practices are open, if you notice all the guidelines, WHO here, our chief dental officer guidelines, they say that we need to have the minimum contact with our patients. So why not to have the oral hygiene instructions remotely? Yeah, and then you can decide according to the risk factors, risk assessments. We can decide to use, as I mentioned to you, either a dental varnish, or if the patient cannot come immediately to the practice, we can advise to show the oral hygiene instructions. And also there is like products called tooth mousse. We can send them by post to our patients. So I don't know, in India you have, or this high fluoridated toothpaste, I don't know if you have. We can prescribe this toothpaste to our patients. Again, if you don't have, maybe at the government policy, maybe yourself, you are very active, active person, dentist, clinician, we can approach to government to have that kind of policies for oral health. So this is, I hope it was clear. So it is a really concept that we need to consider clearly. I mean, if you think about it, to be honest with you, any clinician, we use these. We use, isn't it? We do the risk assessments, we do the prevention strategies, but we can have a structured way within the MID umbrella, so that very clear standard operating procedures for assessment the patient, very clear standard operating procedures for risk assessments, and then according to your risk assessments, such as if your patient has low caries risk, or low periodontal disease risk, or low root surface loss case risk, then you do your strategy according to that risk, or if it is high, according to that risk. So we cannot have one one shirt to fit everyone. Yes, so this is really a typical MID concept in a nutshell. I hope it was clear. Thank you.
That was fantastic, Dr. Aylin, and I totally agree with you, because I think for any disease, for that matter, whether it is dental or systemic, the early detection of any disease is most important. And as you said, that that MID is that concept which leads us to a programmed or structured skill set, to acquire such skill sets, so that we actually practice very well MID, and we are actually doing good to the patient by enhancing their quality of life by early detection. And you actually explained it in a very lucid way, and I think that was fantastic to understand from you, because the things that you mentioned, that is varnish or the tooth mousse, we are quite well aware of all these things. But as you said, that risk assessment is first thing, then according to the each patient, it is more that we are trying to practice personalized dentistry. So that's where the world is going, actually. So that was wonderful. Dr. Aylin, my next bombardment of question to you is that, like, this is a global pandemic, the thing that we are now into, and particularly when we are talking about dental profession, because of this aerosol production in dental procedures, it is a real concern, and it has become a matter of potential concern for, I think, all the dental health professionals all over the world. So I just want to understand from you, does minimally invasive dentistry, or MID, help in this situation? And if so, in which cases a dental professional or a dentist should choose MID to avoid the conventional methods that, the aerosol producing methods of dental treatment, over that we can choose MID. So what would be those can you just explain us that area also? It will be very helpful.
Yes, of course. It's a very good question, and it's very relevant to our era of clinical dentistry, new era of clinical dentistry. So, uh, to be honest, aerosol, it is not very straightforward to avoid, because if the patient comes if they cough, it's an aerosol. If they speak, it's, sometimes it's an aerosol. So, as I mentioned, previously, it's all, we need to be very, very structured with our approach for patient management. So I am happy to go through the standard operating procedures if you wish for COVID, after COVID-19 pandemic in our clinical practice, such as, from now on, as I am sure you heard as well, the patients need to come with a mask before patients they enter the practice. We need to have remotely check. There is a set questionnaire we have from our chief dental officer. I'm sure you must have there as well. So there are very clear questions to understand if they have any temperature, if they have any, anyone in their household with COVID-19 susceptible, etc. All these questionnaire we need to ask to our patients, and then when they come, they can only come themselves. If, of course, if they have, if there's a child patient, they need to come either with the mother or any parents, just one person. So if you notice that it's all minimum contact with everyone, and when they come, they need to come exactly the same time they are asked to do. If they come early, they need to wait in their car. When they come to the practice, their temperature is going to be checked immediately, and they will be provided with a mask. They will have safety glasses, and then there will be no magazines, nothing, no books on in the reception. So that kind of, these are very standard these are the standard operating procedures we need to sort of follow. But your question is really how we can implement MID in a new era of less aerosol, so minimal aerosol. What we can do is, again, this is another, it's MID concept. It's very clear that early detection. So from now on, we need to have a risk assessment tool in our practices, 100%. Then, okay, you may say that, how about the knee patients with they are coming with the dental caries? So how we can implement the MI approach there? If the patient has a non-cavitated lesion, my research over like 15, 19 years actually shows that early caries lesions, non-cavitated lesions, either on the root surface or on the coronal side, when there is non-cavitation, early caries, this is quite important. We can manage them, as I mentioned, with different management strategies according to the risk assessment. And if I may, I could maybe mention one caries risk assessment tool that developed by Prof. Featherstone from San Francisco, University of San Francisco, CAMBRA, so CAMBRA. It's a widely validated caries risk assessment tool. So in that tool, it is very clear that according to the patient's risk assessment, they produced a validated management strategy as well. So that our clinicians, they can use, if they want, they can use that management strategy. So you may say that, okay, we are clear with the early detection, and we know that there are dental varnishes, I'm sure in India widely available, or tooth mousse, it's an over-the-counter product you can use, or the toothpaste, oral hygiene instructions, diet modification, patient education. These are all a package of within the MID. However, when there is a cavitation at that stage, we are advised that minimal aerosol. So what we can do then, ART. So this is another concept within the MID umbrella. It is atraumatic restorative treatment. So ART has been introduced was introduced long time ago, to be honest, for countries, developing countries like Africa. So another researcher, we have wonderful researchers in the world that now we can use their data for our practice. We can say, yes, this is working now, so why not I don't use in my practice? So this another researcher from Netherlands, Franken taught that long time 1990s there was no COVID or anything, but what was happening is in Africa, children's teeth were just clinicians, dentists, they didn't have enough tools, so they were just extracting the teeth. So Franken said something needs to change. So they introduced a traumatic restorative treatment. What it means is there is no need to use handpieces. Initially, it started like this. You don't use handpieces. For open caries lesions, cavitated caries lesions, you use your excavator. You remove the caries lesion. Nowadays, as you know, there is another concept that because everything is about protecting the sound dental tissue. This is why we leave the caries lesion, leathery type of caries lesion, at the base of our cavity where it is close to the dental pulp. So this concept combines with ART concept. This is a wonderful approach for us nowadays. So, we cannot say no aerosol, to be honest with you. If I say no aerosol, it means that, people, it is impossible. As I mentioned, when I speak, like I am producing. So what we can say is minimal aerosol. How we can do that? Reducing the use of handpieces, reducing the use of 3-in-1 syringes, etc. So if Franken in Africa did this without any tools, only with excavator and then using a restorative material, so this is going to become very popular, glass-ionomers. Glass-ionomers, even my recent research shows that, it is an important material that we need to consider nowadays for our ART procedures. So to summarize, we can do the ART procedure using our excavators, and then when we are close to the dental pulp, and if we have a leathery type of lesion there, so all the soft lesions removed, and then just the leathery type of lesion, we can leave that one. This concept, it is called incomplete caries lesion removal. And then we place a GIC and we press with our thumb. When we syringe in the GIC into the cavity, we just press with our gum, a little bit Vaseline, it helps. Press it in our cavity. That's it. If you shape nicely as well later on with your carver, or with your whatever you have the instrument, if you don't have the carver, flat plastic or anything, and then shape it, ask the patient to close the mouth. That's it, finished. And then remove the excessive material, light cure, or if you don't have the light cure, it's fine, just a non-light cure GIC as well. That's it. So I think it is an important techniques. They are important techniques that we can consider. Just one worry is every year I explain this as part of my MID program, because what happened is, when I say every year, we had the MID module in another program, MSc in oral biology. Yes. So I've been doing that module. It's part of another MSc program for over like um, 9 years. So you may say, how did you come up with the MSc in MID then? It was always my passion, and I was doing this MID module. So they were saying, all our students, they were saying, we want to do the practical parts, Dr. Baysan. We want to see the patients with your, the concepts you are introducing, but we are not sure. The worry with the clinicians and with our students is, of course, when you leave caries, how much do we leave? This is a big question. And if we leave, what happens? How am I going to know that our patient will have no symptoms? So again, this is, risk assessment. So I moved from one subject to another, but this is why I said to myself, I am doing this MID module. Why not to do a MSc master postgraduate degree in only minimally invasive dentistry? So coming back to your question again, some clinicians, they may say that, oh, it's okay, Aylin, but how are we going to be sure that, when we leave the caries lesions, our patients will not have any issues? Because, isn't it, your patient may complain, they may say that, oh, you left the caries lesion and now, look, I'm losing my teeth. How we can avoid this? First of all, patient signs and symptoms. Of course, if the patient has, to be honest with you, irreversible pulpitis symptoms, so, pulpal pathology there, there is no way you can do that kind of treatment. So we have to be, again, we have to know what we are doing. These are like, cavitated lesions that you can see. If I say, close to the pulp, but not within the pulp. I mean, of course, some cases you can do direct pulp capping as well, but you need to be very clear with your diagnosis. So to summarize, diagnosis, we need to understand the signs and symptoms of our patients. With the right cases, we can have a minimal aerosol for non-cavitated lesions. And if there is a cavitation, again, we can have minimal aerosol, and we can use the techniques such as incomplete caries removal technique with ART, atraumatic restorative treatment, using GIC type restorative materials. I hope it was clear.
Amazing, amazing, amazing. That is the only word I can tell, because I think you have given a very clear pathway and how to go about it and how to actually implement MID. And the things that you told, to be very honest, we all are taught at the basic level of dentistry. But particularly when we read about the public health dentistry papers, so we are actually taught, but we are actually not taught how to actually implement them. We generally tend to go to more of sophisticated instrumentation part. So as you said, I totally agree that yes, in aerosol is everywhere right now. Even I'm producing aerosol, you are producing aerosol, so there is nothing called as zero aerosol. But but at the same time, this MID concept, if it is taught in a structured way, and as you said about the MSc course, really I am very much getting fascinated. So I think I will take more information personally from you, so that I can spread the news about it to whomever I know, because it will be very useful. Because the thing is, as you said, that diagnosis, that's the most important thing in clinical practice. And only then we can decide, like, whether what to do about it. So I think, Dr. Aylin, that was an eye opener, and whoever listens to you or whoever listens to our conversation later on, also, I think they get a very good insight, because what you are trying to incorporate is through this minimally invasive dentistry concept, is to actually bring those conventional and strong tools in dentistry back. and just not think in one way, but think in a very holistic overall way. So I think that was wonderful from to hear from you. And yes, as you said about GIC, I must add on that recently I think I have shared that link also with everyone, that I have listened one of your webinars, recent webinars, where you mentioned and you showed how these kind of materials are actually helping in remineralization of the tooth structure, and that was fantastic to attend. And well, Dr. Ellen, now not about MID, but then I will ask you something else. That is, I can put definitely you are a person, you are a woman in science. So I would just like to understand that you are a mother, you are a beautiful wife, you are a clinician and a fantastic scientist. But then, how do you manage your work-life balance? Because that is one message that I think everybody will be eager to know from you, because that is where every woman has a struggle of her own. So I think I will definitely like to hear that from you.
Thank you. It's really wonderful questions. To be honest, we are still in man's world, I have to say. I have to be honest, and it's a man's world. And how we manage, how we integrate to this world and show that we can do it. We all, I'm sure you are same, I am all. So we need to be positive, very positive. I have two children. One of them is just became 17, and the other one is 8. So big age gap, but what can I do? You know, sometimes happens. But I am so grateful. First of all, every day when I get up, I say how grateful I am to this life, right? We are in, we are in COVID-19 pandemic, and look, we are still producing, we are working, we have a job. So I am always grateful with what I am. And also, when I help people, when I transfer my information, I feel so completed. This is why it just keeps going. So being positive, being grateful, and always have a plan. Always plan A, plan B, plan C. I know some people, they may say that, oh no, look, COVID-19, even if you had the plan, you couldn't do it. Yes, I know, but we have to show the world that women can manage as well. So unfortunately, we need to have plan. And then I am sorry to say, because my husband always says smart working, but hard working, to be honest with you. Nothing without work, nothing comes to me. I have to do 100% with everything, because, we start the life as a woman, and I don't want to make ourselves, oh, we are miserable. No, we are very strong. I am very strong with everything mentally, and I can do anything, but I have to work hard. Unfortunately, I think I'm happy to work hard, and then I don't get into negative parts, like, I don't have time to dwell with negative people, negative situations. I just have say that, okay, this happens. Is if someone is causing negativity to me, I say to my children as well, just be away from this situation. Don't get into any conflict, or just be away. This is my way of dealing with life. And yeah, lastly, don't give up. Never ever. People tell you lots of stuff. I was told, really genuinely, I was told lots of stuff. I was told, when I finished my PhD, even, I was told that, oh, I'm left-handed, I shouldn't become a dentist. It was a bit too late. So I was told, oh, why I am working so hard. I have two children. I have to be at home. No, just be positive, have plans, work hard, and things will happen. This is the way I deal. And of course, planning is quite important. You know, having two children at home, I need to plan, like this morning, as I mentioned. And then at work, I don't have time to waste. I have to be very efficient because, you know, I have to do my work. At work, I work. Just very, you know, 100% concentration work. When I come home, I do my duties, and then when I do my research, same, very serious. I am, you know, I can be very serious. I'm a very bubbly person, but I am very serious with my work. So I think this is why I am managing. You know, I came what I want to be. Still, of course, I have more to give to the society and for myself as well, for my professional development. I have still lots of roads to go, but I am positive. Thank you. I hope it
That
was
is
helpful.
fantastic, and that you are positive. That I have understood very well, because when I just send you an invitation for Eclectica, just with a single message, you accepted in it so with in a heart welcoming way, and I understood that I have that connect with you, because yes, as you said, we just have to go away from negativity, and we just have to find the right person and be positive, because and yes, hard work has no replacement. And well, Dr. Ellen, with this context, if you don't mind, it's not controversial, but then I will just ask you one very practical question, that is, we often hear about gender bias, particularly when it comes to women, and when it comes to women in science and technology. So, what would you like to add on regarding this aspect? I will just want to know your views in a short way.
So yes, I am again very passionate about this subject as well. And what I did is, last year there was a call for EDI Lead for each institute. EDI is Equality, Diversity, and Inclusion. Lead for from Queen Mary senior management to each university, each institution. Sorry, and I send my statement, and I'm fortunate enough to be selected. So I am the EDI lead for our Institute of Dentistry. And I genuinely believe that what we need to do is, as I mentioned before, still women in the men's world, we are still getting a place, positions. And I am aware that there are, you know, CEOs in very sort of well-known companies as, you know, female CEOs. This is wonderful for us. But in academia, still we have lots of to achieve, to be in boards, in, you know, as vice principals. Where is it? I mean, even in the UK, I haven't come across with principals or vice principals, deans as female senior academics. So what we need to do is here, we need to work together. We are together stronger. So all our female colleagues and everyone, and then we need to show the world that we can do it, you know. And also I believe that at the high level, we need to introduce policies, and we need to make changes at workplaces. I mean, such as I attended a webinar recently. It's from organized by Advance HE, Higher Education England, and they were talking about the job sharing at the senior academic position. Because, you know, end of the day, if you have a family with children, of course, you know, we are a mother as well. We cannot, it is our instinct. We cannot say, okay, now I am a senior academic, so I will not do my you know, duties as mother. No, we have to do this as well. So how we can help to our colleagues, such as, I'm just giving you like job sharing. Why not to consider job share and introducing this to the senior management? So immediately I went back to the because I'm working on the gender equality strategy. We have this Athena Swan. I don't know if you know. This is an initiative that by our again higher education academy. There are some um, protected individuals that we need to look after, such as females, and this is one of them. And so I am working on that initiative as well. So I suggested immediately to the group, can we do something about job sharing, because it will enhance the opportunities for female academics, because maybe they don't want to work for 5 days or 6 days a week, but as two senior academics sharing one job as a dean, or as a lead for, or a department head of department, why not? So that kind of, we have to be very creative with our approaches for policies. So we need to be proactive as female academics and scientists, female academics. So we say, look, why not? And then give a scenario as well. Always give, look, why not this doesn't happen? Like, as I give it, as I mentioned in one example, job sharing. So that kind of policy, slowly, I think we will sort of close this gap. But yes, there is still a gap, gender gap, to be honest with you, parity as well. Yes, even the payments as well. There is another issue that is a long issue, maybe at next time. Yeah.
So, Dr. Aylin, that was wonderful to understand from you. And as you have pinpointed actually the exact things that are really practically, I think every woman who are into any kind of profession, not only like clinicians or dentists, I'm talking about any profession, whether they are in the corporates or any government sector in any part of the world, and particularly when it comes to science and technology, I agree 100% with you that uh, that's a lot of gap, and women should bring women up. That's the only way that we can actually do, because united we stand, as you said. Yes, absolutely. And that should be kind of a, not only at the regional level, it should be a global collaboration, or maybe something like that, because that's very important. Because if we don't support each other, then people will always say that it's always a tag for women weaker section. But actually I think that's the other way around, because that's absolutely not. By virtue, by nature has made us very, very strong. So so I think that was wonderful to listen from you. And to come to the concluding part of this conversation, I would just ask you that what would be or what will be your one takeaway message for our viewers?
I just want to. I love that quotation, but I think it's exactly. I memorized, but I may say it wrong, but maybe incorrect slightly. But there is some darkness needed for the stars to shine. Yes.
Amazing. I think that one sentence explains everything. And Dr. Aylin, it was wonderful, and thank you so much. And I hope in the future we will have more sessions with you and get enlightened about many other aspects. And as you mentioned that you are you are into the administration, or you are into the organizations, and you talk about the bringing women up and many other things. So I think we will have more reasons to get you back again and again here. And thank you so much today for joining me here. And thank you once again. So with that, I will take your leave, and thank you for coming in Eclectica.
Thank you so much. Thank you for your kind invitation.
Okay, so that was a long conversation and a fantastic chat with Dr. Aylin, and it was wonderful. And I am sure that if you are watching us live, or if you will be watching it later, because today we shifted our time little bit, that's fine. But I think whoever watches this, and if you have any questions, you please can mention that in the comment section, because then we will get back to you, and I'll make sure that you get the answers, and Dr. Ellen will be very happy to answer any of your questions that you have. So, with that, I will end this wonderful session of Eclectica, because today I was very excited and to have Dr. Ellen here. And thank you, everybody, for watching this episode patiently. And with that, I will take your leave. Bye bye, and take care and be safe.